Hello, everyone. Hope you're doing well. It's been a long, long time. So, this live Q&A session is going to be all things related to PLAB. And before I start, I just want to make it very clear that मैंने PLAB अभी दिया नहीं है, and neither have I, cleared it, or neither am I a pro. I'm just going to, share some tips about what's helping me prep. Okay, then. Why did you choose PLAB? Why not USMLE? Because I love the UK, and I just feel overall that the exam is more easier to pass, and आपको ज़्यादा आसानी से अपनी preferred specialties मिल जाती हैं UK में. Also, I just feel that USA is very racist, and especially towards Pakistani doctors, and all the trips that I've been there, I did not have, the best experience. It's nothing like what you see in movies. It's ganda. There's, the people aren't very welcoming. So, I just find my overall experience with UK better. Yes, Nagin, I will save this live session and post it as well. Can you budget भी guide कर दें PLAB का? So PLAB 1 is about £235 for the exam. That is about 47,000 Pakistani rupees currently. And IELTS या OET is a compulsion for PLAB. OET is about 60,000 Pakistani rupees, and IELTS is about 35,000 Pakistani rupees. I'm not sure. मैंने OET दिया था, तो that's the one I'm sure about. I agree with you. I went to New York and didn't like it. In the UK, people are very welcoming and open. Yes, that is so true. Like, I mean, I don't want to offend anyone over here, but I just generally feel that, एक तो UK का weather बहुत अच्छा होता है. It's always so hot in the US. UK is pretty pleasant in the summers as well. And I just feel that the people, are generally very welcoming, and, USA के लोग हर वक्त बहुत ही annoyed लगते हैं. Have you done some electives in the UK before? Yes, I have done one rotation in orthopedics in a hospital near our house in the UK. It's in Lincolnshire, and it's a hospital called Scunthorpe General Hospital. It was a very good experience, and मुझे हमेशा से orthopedic surgery में interest था, so that is why I chose the specialty. And it was, and overall, it was very fun. The doctors were amazing. The learning experience was really, really good. So I had a great time. Are you done with your IELTS? How much did you score and how much is required for PLAB? So I did not give IELTS. I gave my OET in February this year, and I scored 430 in 2 categories out of 500, and 420 in 2. So, it was B in all, I'm guessing, and you need a B in all of those categories to clear, to be eligible to give PLAB. And IELTS mein you need an overall band of 7, I think 7 or 7.5. OET की prep कहाँ से की थी? I prepared for OET from this YouTube channel called E2 Language, and सारा जो मैंने उनकी वीडियोस देख देख के प्रैक्टिस की थी For writing, there's this testing service called Benchmark. उनको सारे writing assignments लिख के भेजे थे and they would grade your exam just like an OET examiner would. In fact, उनकी checking थोड़ा ज़्यादा ही strict थी compared to OET, and you would get a really good idea about where you're at and what kind of mistakes you're making, and just tiny details that you would normally not pay attention to. Or yeah, so Benchmark, and then there were these practice tests जो मैंने दिए थे, and just was practicing those tests again and again to make sure that I have a good grip on all my concepts, because OET में writing is the most tricky, and reading and listening is a bit tricky as well. Speaking is the easiest, so those are the areas that need a lot of work. Any particular reason for giving OET instead of IELTS? It's just easier. It has a higher passing rate, and it's more medical based, so it's more relevant for your field, and like I said, it's more easy. How you moved into nutrition from MBBS and why? I have not moved into nutrition. I am still into MBBS. I am working at JPMC doing my house job. Nutrition is just a side thing, a side certification that I did while I was still in med school because I was passionate about it. I'm only a pre-medical student applying for MBBS this year, so could you briefly describe PLAB versus USMLE and if your MBBS final score matters? No. I don't have much knowledge about USMLE, but for your PLAB, your MBBS scores do not matter. All that matters is your score in the exam itself, and obviously your English language scores in IELTS or OET. प्लीज़ डिटेल बताइए प्लैब क्या चीज़ है. प्लैब जो है वो यूके की एंट्रेंस का एग्ज़ाम है. अगर आप डॉक्टर बन के यूके में काम करना चाहते हैं तो प्लैब देना ज़रूरी है आपको. Is house job in Pakistan like F1 foundation year in the UK, or is it different? Yes. So if you give your house job and आप house job करके यहाँ से 1 साल के working experience के साथ जाएं UK, you don't have to start there from foundation year 1. It's the same thing. When do you suggest one should take the PLAB 1? I'm a final year student. Whenever you think that you can prep easily. मैंने जो है अपना प्लैब बुक किया था फॉर नवंबर दिस ईयर, एंड व्हेन आई स्टार्टेड माय हाउस जॉब कोविड की वजह से वी वर नॉट रेगुलर. हम लोग हर तीन दिन बाद चौथे दिन जाते थे फॉर अ 24-hour शिफ्ट. सो इट वाज अ लॉट ईजियर टू प्रेप दैट वे, बट a few weeks ago, 2 हफ्ते पहले we became regular and now we have to go to work every single day. तो तैयारी करना काफ़ी ज़्यादा मुश्किल हो रहा था, so I cancelled my exam and deferred it to March next year. So it is, it does take a good amount of prep. It's getting more difficult, the exam. It's getting more difficult to find jobs or score jobs in the UK because of the pandemic. And it's just, whenever I think you need to give at least 2 to 3 hours a day. And whenever you think that you have enough time and you can prepare easily, that is when you should give it. वैसे PLAB you can give after you're done with your final year. You need to have your degree to give PLAB 1. They don't ask for your degree, but you need to be done with your MBBS. And for PLAB 2, you need to have 1 year of working experience. That is your house job. For pharmacist too, or only MBBS? I'm not sure about pharmacy. I'm sorry. मुझे सिर्फ MBBS का idea है. Save this live session, please. Yes, Sobia, I'll save this live session. Can I buy your exam? Please don't give it to it. How many steps or exams are there in the PLAB? There's 2. The first is an MCQ based exam, and the second is a practical exam जिसमें it's sort of like an OSCE. Part 1 जो है वो दुनिया में हर जगह होता है. It's even conducted in Karachi, and for part 2 you have to go to Manchester. Can we give PLAB after completing house job? Yes, you can give PLAB at any point of your medical career. It's just, best if you give it sooner than later, because like I said, UK में अब जो है jobs काफ़ी कम होती जा रही हैं. It's taking more time for a person to score a job. It's getting more difficult to find a job because of the pandemic. So, it's better to do it sooner than later. I'm a first year medical student, but due to COVID, we haven't gone through proper syllabus and tests. I have months for prof. Is that enough? Honestly, we used to prepare for our semester like ek mahina pehle. I am not recommending that to anyone, but if you put your heart into it, it's definitely possible. What resources are you using for PLAB 1? So I am just using Plabable. Plabable is an app. It also has a very good desktop site, so you can use it on your laptop as well. जिसमें सारा curriculum है. You don't need any extra resources. That is enough. People that go into depths और जो किताबों में ज़्यादा deep theory पढ़ना शुरू कर देते हैं, those are the people that normally fail the exam. You don't need anything else but Plabable. Plabable really, really strengthens your clinical knowledge, your diagnostic skills, so that's all you need. It's an app जिसमें there's mocks, there's revision guides, there's gems, which are basically very, very useful points by category. And then you can, study for a category and attempt practice questions for each category. For example, if you're going to be studying the revision guides for orthopedics, you're going to go through the revision guides and then you're going to attempt the practice questions of orthopedics. And if you get a question wrong in the app, तो वो उसके नीचे आपको सब कुछ explain भी कर देगा that why that is not the answer and why is the correct answer the correct answer. और जो दूसरे options होंगे, they will also tell you why they're not, the correct answers as well, and they'll tell you differentials as well. So it's a very useful app, and you honestly don't need anything else but Plabable. Why don't you prefer doing FCPS? Because I don't want to, and because I want to practice in the UK and do my specialization there and then come back to Pakistan. What's the PLAB examination fees? It's £235 for PLAB 1, and I'm not sure about the exact number for PLAB 2, but I think it's £500 or £800. I'm unsure, but you can find that out on the GMC website. Does your OA level or HSSC grades matter anymore once you're done with your MBBS and apply for jobs? I don't think so. I don't think they do. What subjects are included in PLAB? Everything. All the subjects. Sare medical or surgical subjects, and anatomy, ethics, and some additional topics as well. Not physiology वगैरह, but just anatomy, ethics, and बाकी सारे surgery or medicine के topics. Why didn't you opt for USMLE? I have answered this question before. I'll save this live and you can go through it and listen to it. How much time do we need to study to prepare for the exam? It depends on how much time you can give to prep every single day. अगर आप फारिग हैं और अच्छा खासा time दे सकते हैं, then I'd say you need about 3 months to prepare for it. But if you're not able to give enough time, you're working साथ में, you're in med school and you're studying for med school exam साथ में, तो about 6 to 7 months. Thank you so much. How much do they charge for Plabable? Can I download it right now? Yes, you can download it right now. It's £25 for 4 or 5 months, I think. It's pretty reasonable. Did you do any research or electives in Pakistan? Can you please help if you know research electives program here? It would be any page or website too. Yep, I've not done any research electives. I've done clinical electives in JPMC, in PIMS Islamabad, in AKU, and and UK. Yeah, so I've done 3 in Pakistan and I've done 1 in UK. Can we give PLAB 1 before house job? Yes, you can give PLAB 1 before house job. You can give PLAB 1 right after you're done with med school. Can we start studying for PLAB 1 in 5th year and give our exams during house job? Yes, you can study for PLAB 1 during 5th year. It'll actually help you a lot in 5th year because PLAB 1 ki jo sari prep hai, that involves the same course that is, that you study for final year, medicine and surgery. So if you're studying for PLAB 1 while, you're preparing for 5th year, PLAB 1 ki jo revision guides and all the practice categories and everything, they will really help you with your final year exams as well, because like I said, they really, really strengthen your clinical knowledge and your diagnostic skills. When did you get done with your MBBS? I got done with my MBBS in November last year. Do electives help in getting you an international residency? Well, जितने भी लोगों को मैं जानती हूँ जो यूके में काम कर रहे हैं, none of those have any electives or any research. And a good friend of mine, Nasir, he runs a blog जिसमें you can check out his blog. It's very, very helpful for people that want to give PLAB. He has, he's mentioned everything on the blog, from how to prepare, what resources to use, logon ke experience, IELTS, OET, sab kuch. So you can go and check that out. When I had a discussion with him before I was, before I decided to give PLAB, I asked him the same thing and he said that they do not matter. Only your PLAB scores matter. जितने भी लोग हैं जो वहाँ पे हैं उनमें से पहले तो कोई कॉन्सेप्ट ही नहीं होता था electives का, तो उन लोगों में से किसी ने भी नहीं किए हुए. And he's a doctor in the UK since a few years now, and even he said that he उन्होंने भी कभी कोई electives नहीं किए. But what I personally think is that if अब जितना ज़्यादा competition बढ़ गया है and COVID की वजह से जितनी job opportunities कम हो गई हैं, if you and someone else have a similar score and have applied at the same hospital which has 1 opening, they're obviously going to differentiate between you and the other person over something if your scores are similar. So in that case, they might, be more inclined towards checking your extracurriculars out, like electives or, any tutoring or research, या इस तरह की चीज़ें. When applying for PLAB, do we have to have an experience in electives? No, you don't. You just need to have your MBBS degree. Have you practiced in the UK or US yet? Yup, I've done a clinical rotation in the UK. I really want to do BDS, FCPS Part 1, but I'm really confused. Okay, so I have no knowledge about 1 BDS, 2 FCPS. So, that's a better question to ask someone who, has more experience and can guide you better. So I need to know, after giving PLAB, we direct start training or we have to go through foundation year? Yep, you do have to go through 1 foundation year if you're done with your house job. How long after IELTS OET can we take PLAB? You need your OET IELTS results to apply for PLAB. जैसे ही results आए, you can register yourself for PLAB. What's your friend's blog name? It's Nasir Khan's Journey. But it takes 6 to 7 years to get done with residency in the UK as compared to US. What do you think UK? Why do you think UK is still a better option? I have answered this question before in the beginning of this live session. It's just personal preference. I like UK more. I have a house there. I've had a good experience there. It's one of my favorite places. The people are more welcoming as compared to US, which I do not like and I did not have a good experience with. Do you have any idea about the MRCM, the Royal College Path to UK? A bit, but it's not enough to, guide you properly. You can head over to Nasir Khan's blog for that. He'll be able to guide you better. I've heard we need to only pass the PLAB and score doesn't count. Even Dr. Nasir told us 3 years back it has been changed. Or what? Yes, that's true. You do need to just pass the PLAB and your scores do not matter. But it's still the same. The exam is based on percentile system. That is why how well you perform on the exam matters. There's not a fixed number, ऐसा नहीं है कि 150 में से अगर आपने 75 ले लिया तो आप पास हो जाएंगी. It also depends on how everyone else is doing in the exam. So there's a cutoff. तो इस वजह से it does matter how well you're going to perform in the exam. But specific scores कि अगर आपने पास कर लिया तब आपका कितना score है, that does not matter and it's still the same. The exam, however, is getting more difficult with time. जितने भी लोगों ने अपने अभी experiences share किए हैं, they have mentioned that the stems were longer. They were more challenging. There were these 1700 questions that was very famous for PLAB, जिसमें से सवाल काफ़ी ज़्यादा लगते थे एग्ज़ाम में, and all of them said that they are obsolete now, और उसमें से कोई भी सवाल नहीं लगा. So Plabable is the only useful resource you have right now. Why are you not doing MRCS so you can get core training directly? I just feel that path is more difficult and the Royal College exam is, more difficult compared to PLAB. And honestly, I just want to, start my training in the UK as soon as possible. What is your friend's blog name who guides about PLAB? It's Nasir Khan's Journey. I will save this live, so it'll still be there. You can look it up, and when I post this, I'll tag him in the comments so you can find him easily. After PLAB, what are your plans? In which field you're gonna give exam? So I plan on doing my surgical training in orthopedic surgery, but it's really, really difficult to get surgical training in the UK. So let's see. Do you think our med school grades or distinctions help? No, they do not. Not in PLAB, not in scoring a job in the UK. They don't help. No one cares. Also, I don't even think कि पाकिस्तान में भी कोई jobs वगैरह लेने के लिए your medical scores or, your annual exam scores or your semester GPA or any of that matters. Did you give IELTS or OET? I gave OET in February this year. Thank you so much, Anya. I'm here for my friend and she wants to give PLAB, and also this will help me as well. Will NLE be necessary prior to giving PLAB in the coming times? I'm honestly not sure about that because, हम लोगों की policies ऐसे लगता है जैसे सुबह उठते हैं and they change their mind and just implement something else and then they implement something else. So it's very difficult to be clear about what the requirements are right now. अगर हम लोगों पे वो implement होंगी या नहीं, because we're already doing our house jobs and we graduated last year. If it's going to be for the new people, if we're going to have to give an exam while passing out, so it's all very vague right now. We'll just have to wait and see कि क्या conditions होती हैं, ये क्या implement होता है, या if they decide to change it again, it's just something that all of us are very unsure about right now. Can we directly apply to specialization or it's better to do PLAB first? You can directly apply for specialization. I believe that's the Royal College exam route, and I'm not very well informed about it, but I will tag a blog when I post this in the comment where you can get more info about it. Please guide about OET. I have covered OET in the beginning of this live session, but in short, it took me about 2 weeks to prepare for OET, and there's this channel on YouTube called E2 Language जिससे मैंने preparation की थी, and उसके बाद there's this testing service called Benchmark जिनको मैंने अपनी writing assignments भेजी थी, and they graded me. When I started getting a B+ in my assignments, I stopped because उनकी checking ज़रा ज़्यादा strict है, तो getting a B plus in benchmark does normally mean that you will be able to get a score in the exam itself. Listening और reading के लिए जो है मैंने E2 से ही prepare किया था, and then there was this bundle of practice exams that I took and I attempted, and उसमें भी when I started getting consistent B's, I stopped. For speaking, the same bundle tests that were there, उनमें से मैंने assignments देख के I just made a friend sit with me or my sister sit with me and just practiced my speaking in my opinion is the most easy subtest in OET, because everything that you have to talk about or everything that you have to ask is given in a card right in front of you. आपको सिर्फ बोलनी होती हैं वो चीज़ें, आपको पूछनी होती हैं वो चीज़ें, and there's an examiner who's just acting as a patient and questioning you, and your medical knowledge is not being tested. So even if you say that pancreatitis is a liver infection, they're not going to negatively mark you for it. They're just looking at the confidence that you have and how you're dealing with the patient and what your speaking skills are like. That's about it. So it was the easiest subtest of the exam, and it's the easiest to score highest in. Have you done any researches? No, I have not. I did not in my med school career. I am currently working on a research which is more related to my nutrition field, but med school mein we did start a research, but we were not able to finish it. Not related to PLAB, but are you going to share your experience of getting house job in JPMC and work experience there? So the work experience is great. I mean, there's a lot you learn, and I think the kind of exposure that you get in a government hospital is like no other, but it is very exhausting. It sucks the life out of you. It makes you really, really sad as well, because it's a government organization that has, a lot of funding, but it doesn't look like any of those funds are, applied anywhere or used anywhere, because the hospital itself, we see a lot of patients every day and a lot of pain just because of lack of resources. But yeah, the learning is, it's limitless. Every day you're going to come across something that you would not normally be able to work on as a junior doctor or as an HO. So I do definitely recommend working in JPMC or doing your house job there only if you think you can handle that sort of schedule, जहाँ पे आपको हफ्ते में दो दफ़ा 24 घंटे की शिफ्ट्स करनी पड़े, और 24 घंटे की शिफ्ट करने के बाद फिर अगले दिन जाना पड़े 9 से 5 या 9 से 2 बजे to do OPDs and to do ward rounds. So if that's something that you think you can manage, you should definitely go for it. Can you share any experience, someone with USMLE? So I don't actually have personally know anyone that has given and cleared USMLE, but a couple of my friends are studying for it right now. Does it matter where you've done your house job from within Pakistan? I don't think it does. How much time is required for PLAB 1 preparation? I've also answered this before, but if you're exclusively studying for the exam and not doing anything on the side like med school or your house job or any other job, then about 3 months of exclusive studying. And if you are if you're not able to give a lot of time every day, then about 6 to 7 months for like 100% prep. Why didn't you do your house job in AKU? I did not clear the exam. Could you please save this live for later? Yes, it will be posted on my feed. When are you going to take PLAB 1? In March next year. I had booked it for November, but I cancelled it a week ago because I felt that I was not prepared. And honestly, it wasn't worth the risk because it didn't matter. प्लैब 2 तो आपने हाउस जॉब के बाद ही देना है, तो आप प्लैब 1 जब भी देते हैं उससे कोई फ़र्क नहीं पड़ना था. तो आई जस्ट फिगर्ड दैट it's better to be sure than to take a risk and waste 40,000 रुपये. एंड कोविड की वजह से उनकी रिफंड पॉलिसीज़ चेंज हुई थी, तो इवन कैंसलिंग राइट नाउ आई डिड गेट 100% रिफंड. सो दैट वाज जस्ट a decision I took for the better. What do you recommend, government or private hospitals for house job if we are planning for PLAB 1? Definitely private, because that will give you, your routine will be less hectic and it will give you more time to study. My dad's a PLAB examiner and I know how tough the prep can be. Good luck to you all. May Allah grant you all success. Thank you so much. Hi Anya, what happened to your under eye? So this is a very funny and long story, but it was a minor household injury which really never went away. What resources should I use for the prep? All you need is the Plabable app, and that's about it. You don't need any other resources. You can get the Oxford handbooks for just reference, or if you'd like to read further about it, but even those aren't necessary. I've heard that we only have to clear PLAB 1. Is that true? No, you need to clear PLAB 2 as well. What are the sources of study for PLAB 1 apart from Plabable and PLAB keys? So I do not recommend going into a lot of deep prep for the exam. These are the only 2 things that you need. And agar aapki tayari, if you have completed and done everything about the PLAB, everything, if you've completed Plabable, आपने mocks भी कर लिए हैं, practice questions भी कर लिए हैं, PLAB keys भी पढ़ ली हैं, gems भी पढ़ ली, and you still have time left, then you can do Plabable 1 or 2 times again, ताकि it's everything is on your fingertips. And if you're done with those and still left for the exam, because there are a lot of people जिन्होंने इस साल PLAB book किया हुआ था, but January February से कोई exam नहीं हुआ है कराची में, September वाला भी exam cancel हो गया है. So people have been preparing since quite some time and अब भी उनको exam नहीं दे पा रहे हैं. तो in that case you can use other resources as well, like Medscape or the 1700 questions. They're obsolete now, but obviously उनमें भी आपकी clinical knowledge काफ़ी ज़्यादा strong हो जाती है. तो anything that strengthens your clinical knowledge, basically when you go to give PLAB, your prep should be मतलब ऐसी होनी चाहिए कि अगर आपको कोई बोले कि stomach ache और fever है, तो आपके दिमाग में 10 differential diagnosis आ जानी चाहिए. You should know the tests, you should know the signs, you should know the symptoms of every single disease. Everything should be on your fingertips, and especially major categories में, like neuro, like cardio, like respo, like psychiatry, inside pediatrics, emergency medicine, इन सारी चीज़ें should be very very strong. और जो minor categories हैं, like vascular surgery or dermatology or ortho, those उनमें थोड़ा सा leniency आप you can be a little lenient, but the majors should be very very strong. Did you like your med school? Yes, I did. It was really refreshing to study in a med school which was so clean and comfortable and just just very sanitary and hygienic compared to government. No way am I looking down upon government organizations, but it's just it's very difficult now that I'm doing my house job there. मतलब हम लोग रोज पानी भी literally एक घूंट पी रहे होते हैं, so we don't have to go pee and use the dirty washroom. तो उस लिहाज से it was very nice, and it was very a comfortable experience for 5 years. But other than that, I feel that med school, 5 years of med school are more about your own studying than what your teachers are teaching you. Because आप किसी भी med school में चले जाएं, होगा यही कि एक lecture आएगा and they will start a couple of slides and give you a lecture, but it's more about what you're giving outside the classroom than what you're studying inside the classroom, in my opinion. I mean that was my experience for 5 years. What are you planning to specialize in? Orthopedic surgery, inshallah. Any online forum groups on Facebook or elsewhere we can join for PLAB prep? Yep, you can just write PLAB on Facebook and tons of Facebook groups should pop up. Can you please tell that which fields are good for female doctors to do specialization? I don't think fields are gender specific. You can specialize in any field that you feel like. When I tell people that I want to do orthopedic surgery, everyone just is like, तुम लड़की हो, तुम कहाँ से ऑर्थोपीडिक सर्जरी करोगी, और उसमें तो इतनी मैन पावर चाहिए होती है, और वो तो मर्दों की स्पेशलिटी होती है, शादी हो जाएगी, टाइम कैसे दोगी, और इस तरह की चीज़ें. इट्स अ सर्जिकल फील्ड, देयर इज ट्रॉमा, देयर इज एमरजेंसी, एंड you don't need to listen to any of that. Just do whatever you're passionate about. And what about college? Yeah, our college was a fun experience as well. Can we still use Plavable if we don't go for PLAB, just like for clinical skills or knowledge? Definitely. Even if you're not giving PLAB and you're in med school, I do recommend Plavable for final year students, because it will definitely, मतलब वो आपकी clinical knowledge इतनी ज़्यादा strong कर देता है that I've prepared for a good amount of time for Plavable, and now when I'm watching a show like House or Grey's Anatomy, और उसमें कोई केस आता है तो मेरे दिमाग में automatically differentials आना शुरू हो जाते हैं. तो it's a really good resource for clinical knowledge. What is Plavable, an app or something? Yes, it's an app. Can you brief what budget we should keep in mind for OET and PLAB 1 and 2? You will be able to have a more precise number from the blog that I mentioned when I post this live session. But PLAB 1 is about 40,000 Pakistani rupees, 47,000 or 40,000, I'm not sure. It's 235 pounds, jitne bhi wo bante hain. And OET is about 60,000 Pakistani rupees. PLAB 2 is about, I think, 80,000 or 100,000. I'm not sure about the number, but it's something like that. Baki PLAB 2 आपको UK में जाके देना पड़ेगा, तो जो टिकट और वीज़ा वगैरह लगेगा वो अलग है. Then it's very, very important for PLAB 2 that you study and prepare from an academy. So that is, वो उसके अलग charges होंगे. फिर obviously when you go to the UK to prepare for an academy, you're going to be staying at an accommodation. You need to keep that budget in mind as well. Food, travel while you're in the UK, all of that included. So Nasir Khan's blog should, be able to guide you better. I will mention him in the comments. From where you graduated? I graduated from UMDC in November last year. Okay, guys, so I think I've covered all the basic topics and everything that, I could guide you guys about. बाकी जो चीज़ें थी वो मेरे area of expertise से बाहर थी. So I will mention, a blog in the live, in the comments when I post this. And you can, visit the blog and just read everything there is that I was not able to answer. And I will do live sessions frequently. There are a few more things that I'd like to talk about, PLAB वगैरह के अलावा. And inshallah, whenever I get time next, I will come again and, just answer everything. Hopefully, if I can commit to this again. It was really, really nice talking to all of you after such a long time. And I will see you guys again soon.